So I am starting the session now. Thank you very much for giving me this opportunity to present this session. And I would request Pavitra ji to start the video. We'll go through a video, short video about the basic structure of that COVID virus and how the epidemiology, how it transmits, and then what are the diagnostic features and the clinical features. There is a short video on that. So let us go through that first, and then we get into the preventive aspects.
A virus is really just a hull around genetic material and a few proteins, arguably not even a living thing. It can only make more of itself by entering a living cell.
The coronavirus must infect living cells in order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. Both a typical influenza virus and the new coronavirus use their spikes like a key to get inside a cell in your body, where it takes over the cell's internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles which merge with your cell's outer layer, the cell membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then, a new virus begins to bud off from the cell's membrane.
December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers.
Corona may spread via surfaces, but it's still uncertain how long it can survive on them. Its main way of spreading seems to be droplet infection, when people cough, or if you touch someone who's ill and then your face, say rubbing your eyes or nose. The virus starts its journey here and then hitches a ride as a stowaway deeper into the body. Its destinations are the intestines, the spleen or the lungs, where it can have the most dramatic effect. Even just a few coronaviruses can cause quite a dramatic situation.
How does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet.
With the virus spreading in your body, how can you develop pneumonia symptoms? For this, we'll have to look into your lungs. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon. And when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries, and then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. In a healthy body, hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you might expel them by coughing. Normally, cells of your immune system attack viruses and germs that make it past your mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in the case of a coronavirus infection, the virus can overwhelm your immune cells, and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. The inflammation can cause your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. You could develop lobar pneumonia, where one lobe of your lungs is affected, or you could have bronchopneumonia that affects many areas of both lungs. Pneumonia may cause difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. It can also lead to more serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. These are the machines that save lives and that medical device companies currently ramp up production for. Whether you would develop these symptoms depends on a lot of factors, such as your age and whether you already have an existing condition.
How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development.
Coronavirus is often compared to the flu, but actually it's much more dangerous. While the exact death rate is hard to pin down during an ongoing pandemic, we know for sure that it's much more contagious and spreads faster than the flu. There are two futures for a pandemic like corona: fast and slow. Which future we will see depends on how we all react to it in the early days of the outbreak. A fast pandemic will be horrible and cost many lives. A slow pandemic will not be remembered by the history books. The worst case scenario for a fast pandemic begins with a very rapid rate of infection because there are no countermeasures in place to slow it down. Why is this so bad? In a fast pandemic, many people get sick at the same time. If the numbers get too large, healthcare systems become unable to handle it. There aren't enough resources like medical staff or equipment like ventilators left to help everybody. People will die untreated. And as more healthcare workers get sick themselves, the capacity of healthcare systems falls even further. If this becomes the case, then horrible decisions will have to be made about who gets to live and who doesn't. The number of deaths rises significantly in such a scenario. To avoid this, the world, that means all of us, needs to do what it can to turn this into a slow pandemic. A pandemic is slowed down by the right responses, especially in the early phase, so that everyone who gets sick can get treatment and there's no crunch point with overwhelmed hospitals. Since we don't have a vaccine for corona, we have to socially engineer our behavior to act like a social vaccine.
I welcome all of you for this presentation on prevention of COVID-19 infection in the community. Now, as we discuss about the preventive measures in the community, it will be almost the same as we do it in the hospital, as the nurses do it in the hospital. So more or less, those preventive measures are to be taken. Only thing is, at community, all the equipments are not available. So we have to see how much we can utilize our home available things and then stay protected. First is the protection of the head. Whenever we are going outside, we need to protect our head, and that because the COVID can pass through fomites, and also it can be resting on the surface for a longer time. So better to cover the head whenever we are going outside, maybe using a hood or a hat or a turban or something, or if possible we can use the disposable surgical caps, which are 3-ply ones available in the pharmacies. Now, next thing is the eye protection. This is an advice to everybody, like say at home, try to wear a zero power specs. And whenever you are going out, if you have the safety glasses or a protective goggles, to wear that, because the conjunctiva is a very sensitive organ and it's very vascular one. So the infection can enter through our body through the conjunctiva. So better to stay protected as we go out. So now, protecting the face. The most important information you can see everywhere nowadays in the media also, that do not touch your face, is a very important thing. There is a T junction, T structure on the face with the eyes, nose and the mouth. We should not touch any part of it, because many times the infection will be, the virus will be there and it can enter our body through these openings. And always wear 3-ply surgical mask if it is possible, or otherwise you can use a reusable face mask with if you are using a reusable face mask, always use a paper of kitchen tissue inside that as a double protection. So that will be better than then you don't need to use a N95 mask. So there is no need for N95 mask in the community. This is a very important message. So always go for a 3-ply disposable surgical mask if you are getting it. Otherwise, use any kind of cotton mask which is reusable, but use a tissue, layer of tissue inside that. Now, this is to protect the airway. This virus actually spreads through the aerosols. So we have to protect our airways so that the virus doesn't enter our body through the airways. Then that is the most important thing, is cover the nose and mouth with a face mask or a tissue whenever we are sneezing or coughing. And then if you are using the tissue, dispose it in a bin, trash bin with a lid. The hand washing techniques: before we wash the hands, we have to remove all the jewelry. And then the next thing is cleaning the hands in running water if available, and then scrub the hands for at least for 20 seconds whenever you are washing the hands. And otherwise, use the sanitizer which is having more than 60% alcohol. That is what is actually advocated by the WHO. Next thing, next please. Next please. Now coming to the surface protection, whatever items we buy from outside, whatever items, maybe grocery items or any fruits, vegetables, they need to be cleaned. So always keep a bucket, empty bucket outside the room with a lid, or a large container with a lid where the vendors can drop their items. Try not to touch anything which is directly touched by the vendor before they are cleaned. Now that bucket, you can clean it with the Dettol or any kind of disinfectant like a surgical spirit. That can keep the surface very clean, and before we take the item inside our room. Next, please. Now, whenever we are going outside, after coming back home, we should immediately go to the washroom and take shower with soap and water immediately, and then dip all our clothes in detergent solution and clean them immediately. This is very important before moving to the other parts of the house. The advice will be not to go out often, minimize venturing outside as much as possible now, because the community spread has happened and we don't know who is positive and who is not. Next, please. Now clean the surface of every shopping item except eatable with surgical spirit and antiseptic solution after receiving them at home. That means any kind of packet comes, we have to clean the surface with surgical spirit or any kind of antiseptic solution like Dettol or Savlon, something we can spray on that. That is the thing we can do. But for eatables, we have to do something else. I'll be talking about it a little later.
Next slide, sir.
Next, please. Yes. Now for fruits and vegetables, you need to soak them in water with vinegar and baking soda for 20 minutes and then rinse them dry with the kitchen tissue and towel. So this is the thing you can do for the fruits and vegetables. Always use vinegar and baking soda because they will take out all the toxins and any kind of dirt, anything is on the surface, that will be removed. And also it will disinfect the fruits and vegetables. Next, please. Now we need to protect the vulnerable population. The vulnerable population means the people who are at risk of getting the disease and fall sick with the COVID infection. These are the elderly, the sick patients, as well as the pregnant ladies. Anybody who is at sick or who is elderly, we try to keep them in a separate bedroom with attached toilets if it is possible. It's wherever it is feasible actually, because all the houses are not having a separate bedroom for the elderly and the washrooms. So wherever it is possible, better to protect them at this time when there is a community spread of COVID. Next, please. The sick people means here those who are smokers or having any respiratory problems or cardiac problems or diabetic or hypertensive. These are the people who should be protected, or suffering from any kind of chronic ailments like kidney or lung disease. Now, better to avail the telemedicine services provided by the doctors online and avoid going to the polyclinics and the hospitals for minor ailments, because these are the places where many people are visiting, and nowadays I find that many people are actually taking paracetamol and anti-allergic things and visiting the hospitals and healthcare. They are hiding their disease. They are not telling that they have fever or anything, sore throat or anything like that. So that is why the disease is spreading. Before we can take any precaution, they have already moved to so many places inside the hospital or in the polyclinic. So it's better that at this moment when the spread is high in the community, better not go to the polyclinics and hospital for minor ailments. Always try to look for the telemedicine services as much as possible. And if the doctor says that, okay, I cannot manage it at home through telemedicine consultation, then you move to the hospitals for better care. Next thing is e-learning. This is the thing which we discussed today also. My advice will be now, from now onwards, because we are expecting another surge of this COVID pandemic, maybe in the winter. It might come out in a very severe form, the second outbreak. So that's why we might have to go for an e-learning mode for a longer time. So my suggestion will be try to look into the curriculum and see how much of the curriculum can be converted into e-learning mode. And maximum can be e-learning thing. Only thing is some kind of practical work or clinical teaching, they can be done only on a face-to-face manner. But wherever possible, go for e-learning mode, maybe small group discussions, or maybe PBLs, or maybe just like this webinar presentation, something like that, and try to readjust the curriculum as much as possible. And ask the students to come to the university or the college minimum time as possible, maybe once or twice a week, not more than that. Next, please. Now, wherever possible, go for the online transactions. If you have to pay somebody some money, try to see if he can accept it through Paytm, PhonePe, or even Google Pay, and then pay them through online wherever possible. Don't touch the money as much as for the time being, because the infection can spread through these hard cash. Next thing is, whenever you are doing shopping, always try to look for the online orders and try not to visit the marketplace as much as possible, or the crowded areas.
So next slide.
Next, please. Yes. So this is the thing I was telling you, not to go to the marketplace unless it is absolutely necessary. Try to order things online as much as possible, because in marketplace and shopping malls, there will be these are crowded places where you might come in contact with people who are positive. Even for medicines, grocery items, stationery items, you can order everything online. Next, please.
Yes, sir.
Now, coming to social distancing, now the situation is very grave, and we know that we have to live with COVID. There is no way we can get rid of it, and the way it is actually mutating and becoming stronger day by day, it's we might have to maintain the social distancing for a long time, and avoid touching people or avoid social gatherings as much as possible. And wherever possible, we can greet the people like namaste posture, or even wave the hands or salute the people. This is the way we can actually maintain our social norms without coming into direct contact with anybody. Next, please. Now, whenever we are going to the shopping malls or even marketplaces, we need to maintain this social distancing. That should be at least, say, 6 feet distance or 2 meter distance from the next person. So wherever possible, we need to maintain that, and let us make it a habit now for the next 2 years till this problem is subsiding. And this social distancing is actually maybe not for us, but it is to protect our family members. Always remember that in most of our family, we have elderly people, we have some people who are sick, or we might have some people who are pregnant. So we have to save them. It is basically, I might be healthy, but through me the COVID virus can come inside our room and then attack our family members, and they might be at danger. So in order to protect the family, we have to stay at home and do the things online as much as possible and avoid going out. Now, the next thing is, there will be intermittent lockdowns from time to time. Whenever cases are more, it will be treated as a hotspot and the government will be calling for a lockdown. So always follow the lockdown rules whenever it's possible, because it is giving the healthcare facility some time to reorganize itself and time to cater to the needy. Because many times in healthcare system, we find doctors and nurses are falling sick, so they need to be quarantined. So they need some time to come out of it. So this is a very important thing. Whenever there is a lockdown, please follow the rules. So thank you very much for my presentation. And I hope that you will be having some questions to discuss. I'll be happy to take your questions. And these videos are already uploaded on the YouTube. Whenever you get some time, you can go through it, and then my contact number is always provided there. So you can communicate with me if any clarification is required. It's very unfortunate that in Calcutta it is stormy weather now, so the transmission is always interrupted. But thank you very much for your patience hearing, and I'll keep the forum open for discussion now.